carcinoma. That's the most common form of skin cancer. Typically, treatment involves a surgery to remove layers of skin, which can take hours to perform. But there's a new procedure that could be a real game changer.
Radiation had been used for various things. Now we're using it again for skin cancer. However, we can use low doses of it since skin cancers are generally very superficial. That little red patch, that's actually the tumor what you can see with the naked eye. We actually can do a non-surgical removal of this tumor. We can do something called low doses of radiation. Limits the radiation just to the targeted area. Those are tetracaine drops. The tumor shows up a lot better now. We'll be providing shielding and it'll protect your eye. The machine itself is a low-dose radiation therapy system. It provides radiation no deeper than the skin itself. So we are treating the entire depth of the skin and the outer regions of the tumor. You okay?
I'm done.
Betty is here with Dr. Forman, who's one of only a few dermatologists offering this type of treatment, and this is a non-surgical option for basal cell carcinoma. Welcome to you both.
Welcome.
And I think it's important to note that the way you're treating basal cell carcinoma with this procedure is very different than the way we did in the past.
Yes, it is. Actually, the most common procedure these days still is surgery, and the tumor, the basal cell carcinoma that Mrs. Cameron had, would usually require micrographic surgery, which can take hours to even a day or two.
So you're using radiation to kill off the cancerous cells, much like we do for other types of cancer.
Exactly.
So again, Betty was your patient, and what was the procedure like for you?
Well, it doesn't take long. It's just like having an X-ray, and it's painless, and it's over within 45 seconds. So.
But it doesn't entail just one treatment, right?
That's true.
She's going to have multiple treatments to eradicate her cancer.
Exactly. We have her come back 12 times over a 4-week span. But throughout the therapy, she has no shots, no blades, no bleeding, no stitches, not even a Band-Aid.
Now, have you gone through all the treatments?
I've only had 3.
So you've had 3 treatments, and I'm looking at you from this distance, and I'm trying to figure out where was
it was
where I really cannot tell.
It was her left lower eyelid, and you really do not see where she had this. But we have to take this opportunity to talk about what? Prevention. And number 1 is try to avoid that daytime sunlight, and that's between the hours of 10 to 4. If you can schedule activities in such a way that you avoid that midday sun, that's very important. What else? Sunscreen, sunscreen, sunscreen. So important. And at least an SPF of 15, we recommend 30. You've got to be generous with how much you apply. We talk about a shot glass full. Reapply that sunscreen every 2 hours. And finally, what you can do is wear protective clothing, like that. So I see you want that one, Dr. Travis.
Well, it will. It'll say UPF 50+.
This blocks both UVA and UVB light and is a great way to go because you can't get sunscreen on everywhere, so protective clothing is so important. And for everybody in the audience, our friends from Coolabar are sending you all home with a gift certificate so you can redeem that for one of these sun protective clothing items.
Great option. And you look great.
Good luck to you, buddy.
Thanks so much for sharing this technology with us. Next, it's Jillian's DNA test results. What will they reveal? Find out next.